So our question that came in that there's always some confusion for the new coder on the differences between 95 and 97 E&M guidelines. And yes, that is a lot of confusion there. So we had some simple facts to put them apart. Let's see here. So the question was, they were hearing about different sets of guidelines, and how do we know which one to use, and will they ask that on the CPC exam is what I think they meant. So Medicare is actually the ones who established these two different sets of guidelines. So in 1995, they came out with the first set of guidelines. They were pretty generic. It wasn't directed towards any specialty at all. So it became a little confusing for most people because the exam component of that E&M level, it didn't specify how to distinguish between an expanded problem focused and a detailed exam. So you have 4 different levels of an exam, but 2 of them were almost the same. So the expanded problem focus said a limited examination of the affected body area or organ system and other symptomatic or related organ systems, where a detailed was an extended exam of the exact same thing. So what's the difference between a limited and extended? And a lot of people were having problems, say, in cardiology or neurology, some other kind of specialties, because they couldn't really get all of these other body areas or organ systems because they're mainly dealing with one. So in 1997, they came out with a new set of guidelines that was almost the same, but when it came to the examination, they included specialty, or they were organ-specific exams, and then gave you box or checklists or bullets that you would meet to pick your E&M level. So there's another difference between the two was in the history of present illness. So in doing your HPI, when you're looking at an extended HPI, the 95 guidelines said that it should describe 4 or more elements of the present HPI or associated comorbidities. But the 97 guidelines gave that a little bit more difference. You need those 4 or more elements, or at least 4 elements, or the status of at least 3 chronic or inactive conditions. So you think of those cardiologists or the primary care doctor or somebody in that field. They see these people constantly every month or every 6 weeks or so for their diabetes, for the high blood pressure, things like that. So at least if they're following up their 3 chronic problems, then they could meet that qualification as well. Providers can actually choose between the 95 and the 97 guidelines. We talk about this a lot, as it should be in your compliance manual as to which one you follow. That way, in case there's ever an audit, they already know that you like to follow the 95 guidelines. But it's whichever is most advantageous. So if you use the online Medicare tool, they usually default to 95 because it becomes a little bit more advantageous for people. But you have to use one guideline or the other. You can't mix both. You can't use one part of one and one of the other. When you're doing a CPC exam, they're not going to ask you to level an E&M. They're going to say, they'll present the question and then they'll give you criteria and they'll want you to pick the E&M. So something like the patient is seen in a follow-up for a hospital, or in the hospital for a follow-up visit. They did a detailed history, a detailed exam, and the medical decision maker was high complexity. So what code? And then A, B, C, D. They'll give you those codes. So it'll be something like that. They're not going to say the patient was seen on this day for these problems and what level is it. So when they get more detailed like that, that's going to be your certification exams for a more detail, like the CPMA for the medical auditing exam, or perhaps the CEMC, which is a specialty of just evaluation and management. That's where they're going to have you look at it and want you to actually level an E&M. They usually suggest you have at least 2 years of experience before you try and be a CPMA or something. They want you to see these things. It really takes repetition, going over and over, and you need to have these done often enough to know what you're looking for. So in one of the exams for those, they might say, they might tell you in the question, a coder used 1995 guidelines, or answer this question using the 1997 guidelines. So you're able to bring those sheets in with you that tell you the guidelines to those more specialized certification exams. But on a CPC exam, they're not going to ask you to level those. The website that I included here is the CMS website. They break out 95 and 97. It's a whole booklet, and it gives you all of the information you would need. It's like 98 pages or something, but it breaks it down for you. It tells you all the bullets of those specialty exams in 1997. So it's a very useful tool. I actually keep it saved on my desktop and refer to it often. So between the difference of those two, it just breaks down a little bit between the exam and some of the HPI. So it's a little bit more detailed for specialty for 97 guidelines. Otherwise, most people use 95.
And I just pasted that link in the chat for anyone that wants to grab it.
Do you need more medical certification and business training? Learn more at www.cco.us.